Sabah El Kheir. Today, I'm so excited to welcome a very special guest to the show. We have Dr. George Karam, psychiatrist.
Hi,
Welcome.
thank
This
you.
is so exciting. I hope that you're,
I
feeling
am,
all
I am excited.
cozy.
Beautiful studio, beautiful setting. I love it.
Thank you.
And
Thank you.
Mabruk.
Thank you. So, I have a little introduction about you, but definitely I would love to hear more from you.
Okay.
So, Dr. George, you're a psychiatrist.
I am.
You lead the psychiatry and clinical psychology department at St. George Hospital. You're also the associate dean at St. George University's Faculty of Medicine
Correct.
and executive director at Idrak and Mind.
Hmm.
Okay.
Yeah.
Wow.
I do several things.
Yeah,
And I love it, I
I
love to
can
be
tell.
busy and I love to give back and I
Hmm.
love to help people. So that's why I chose psychiatry and it's wonderful.
That's amazing.
Yeah.
Okay. Can you tell us a little bit more about that and yourself?
So my journey started in the US. I
Hmm.
went to medical school in the US, then I did my training there in psychiatry. Then I decided, so in adult psychiatry, then I decided to subspecialize in geriatric psychiatry.
Yeah.
So in addition, I am the president of the Alzheimer's Association in Lebanon. So I have a special interest in that. And then after spending 10 years in the US, I decided that I wanted to come back to Lebanon. My family is here, my roots are here. So I came back to Lebanon almost 18 years ago.
Wow.
And not once I regret coming back, not even now. We are in the middle of a war.
Hmm.
The last 6 years have been really terrible on Lebanon, one trauma after the other. But even with that, I'm so lucky that I'm in Lebanon and I'm grateful that I'm here. And I love what I'm doing. And I think Lebanon and people need psychiatrists, psychologists, mental health professionals more than any other time in the last 6 years. So the more we can give, the better it will be. And it's very rewarding. So I'm really happy to be here.
I love that. And you were saying that you lived in the US, and it's just such a crazy coincidence that you were in St. Louis. I
Yes.
was born in St. Louis. Like, what a small world because not many Lebanese people that I meet ever
That,
lived in St.
it was
Louis.
crazy, just finding this
Yeah.
out before the interview
Uh
that we were
huh.
both in St. Louis. We used to go to the same places
Yeah.
and
Same church,
it's
same.
it's
Yeah.
it's crazy. Yeah. What a small world. It's
Mm-hmm.
amazing.
And another thing, we have the same last name, Karam.
That too.
So
That too.
I
It was
mean, it
meant to
was it
be.
was meant to be. What does a usual morning or day look like for you? How do you have like positive things that you do throughout to keep yourself feeling good, your mental health and everything?
What I always tell everyone, and I do it myself. So I
Mm-hmm.
practice what I preach is to maintain a routine. Number one, this is extremely important. The more you maintain a routine of your day, the better you're going to be. Number two, and that's part of my routine, is physical exercise. So maintaining a routine and being engaged physically in exercise on a regular basis are extremely important for your mental well-being. So the way I combine these two is that I exercise every single morning. So in fact, 6 days out of seven during the week I exercise, and my routine is from 7 to 8 every morning I exercise. Either I go to the gym for weightlifting or I run. So I do both at the same time. And by doing that from 7 to 8, I wake up every morning at the same time. 6:37, I'm at the gym. 8, I'm back. 8:05, I'm back home. To take my shower to be in the hospital at 9. So my working day starts at 9 a.m. and I work really long hours. And the only way I can maintain that and working long hours and taking care of patients, taking care of many responsibilities is by exercising 1 hour in the morning. It gives me a lot of energy and it gives me a peace of mind. And by having this routine where every day I'm doing exactly the same, that is extremely beneficial. Because people sometimes they look at routine as something negative. Oh, he has a routine, that means he's boring. That is not true at all. The more you stick to a routine, the better it is for your mental well-being. And we knew that during COVID, when suddenly all of us were at home, all of us did not have our routine that we're used to. Maybe the first 2 3 weeks we were happy with that. We felt that we are on vacation or whatever it is. But after the third week, problems started happening, among couples or among families, and the fact that you were stuck at home and your routine was completely changed. That's when you started seeing the problems. So that's why my advice always, and now we are in difficult times in a difficult situation. The more you can stick to a routine, the better it will be for you. Especially also for kids. The more you put them on a routine, the better it is. And probably you know that. So when you have newborn babies, if from the beginning, since they are like 1 week old or 2 weeks old, you're giving them their bottle at 7:30 p.m. every night. You're giving them the shower at 8 p.m. 8:15 they are in bed. So if you put like a rigid routine, these babies end up sleeping better. These babies grow up to be calmer and more easygoing. And all of this is due to a routine, because you're training your body, you're training your brain to be methodical and to be systematic. If you apply that to our life as adults, we will really be much better.
I
So that's how
agree.
my
I
dad's
love
life.
a good routine.
Yeah.
I think that the time when I don't have a routine or I'm filling my time with things that, you know, give me some sort of like, I feel productive, I feel like I'm doing something, my day is just all over the place.
You feel
So,
lost. You
yeah.
feel lost. And in fact, there was a study that was done that was really interesting that showed that during working days, let's say from Monday to Friday, 93% of your days are on the same routine. And this is very helpful. So if you look at if you're an employee from Monday to Friday, you wake up at the same time every day. You're probably having your coffee the same way. Either if it's a black coffee, it's a black coffee. You're not gonna change. One day is black, one day with milk, and one day with sugar. So it's routine. You probably start getting dressed the same. You have your own style of dressing. You're taking the same road to go to work. You're taking your lunch break at the same time. You're taking your coffee break at the same time in the afternoon. So it's the same routine. And this is done on purpose because you save time. You don't have to every morning reconsider how am I going to have my coffee today? Or I'm not going to lose time to see if I want to take a different road to reach work. I'm not going to lose time to say, should I take my lunch break at 12? No, I take it at 2 p.m. No, I take it at 1. Once you have this routine, you gain time and you are more productive. And that's why, sticking to a routine is really very helpful. So if 93% of our time is on the same routine, except the weekend is on the same routine, this is done on purpose. And I'm going to emphasize and emphasize and emphasize that point. Please stick to a routine and you will feel better.
Okay. I love that. I'm
Yeah.
starting tomorrow. What would you say you're seeing a lot amongst people now, young adults, when it comes to mental health?
Anxiety, a lot of anxiety, a lot of depression, but anxiety even more so than depression because we are living in an uncertain time. And uncertainty is the worst thing you can do for your mental health. When you don't know what's going to happen in 1 hour, when you don't know what's going to happen tomorrow, when you cannot plan, your summer vacation, when you cannot plan a wedding, when you cannot plan to have a conference, when you cannot plan anything, everything is on hold. And this uncertainty is terrible. And that's what causes a lot of anxiety because you really don't know what you're going to do. And we see a lot of people, suffering from anxiety because of this uncertainty. And war is terrible because of that. War is terrible because you're scared on your physical safety, obviously. War is terrible because the fear of war can cause anxiety. But uncertainty that comes with war also plays a very, very, very important role. And that's why my advice, we cannot control what's going to happen, right? You did not start the war. I did not start the war. You don't have a say when it's going to end. I don't have a say when it's going to end. And none of us have a say. So my advice would be to really focus on what you can control. And there's a lot of things you can control. So even though we are living in an uncertain world, we are living in an uncertain times, but I can control my routine. I can control if I'm going to go to the gym or not. I can control if I can go to work tomorrow, unless something happens, but I can decide that tomorrow I'm going to work. I can control the fact that I'm going to try a new recipe tonight because I saw it online and it seems interesting and I want to do that. I can control the fact that I'm going to spend quality time with my kids who are starting their vacation, let's say in 2 days. I can control, if there is no war, that on Tuesday I will go have dinner with my friends. So these are small things and they might appear as trivial or small things. But honestly, these are the small things that you can control and these are enough to take care of your mental well-being. You don't need to control everything in your life. You don't need to be controlling what's going to happen in 10 years. As long as you can control from day to day what you're going to do, that is enough to help you navigate these uncertain times. So really focus on what you can control.
I think control is a big thing because a lot of people want to control every outcome and not having that sense of like ability to do it.
And that's when you burn. That's when you burn
Yeah.
out. You know, no one asked you or anyone, you know, to be in full control of everything. And I see that in the office, in fact. When people come to me and they feel that they're losing the sense of control, someone who has, let's say, either someone who has OCD or someone that has the personality, or, you know, obsessive compulsive personality disorder, when they feel they cannot manage everything, they're not in control of everything, they break down. Well, and my advice always is, who asked you to control everything? And there's a theory that is really interesting. It's called the four burner theory, where imagine your life is four burners. You know, you have a cooking stove and you have four burners. One of them is your life, your professional life. The other one is your family. One of them is your social life. And the fourth one is your health and your exercise. Okay, these are the four burners of your life. And your lifespan is a gas jar, you know, that you attach. If you're going to have all four burners blasted to the maximum, what's going to happen with the gas jar? It's going to empty very quickly. You're going to burn out. You're going to crash. You will not be able to do so. So if you want that gas jar to last you a long time, so if you want your life to last a long time, you need to have control of these four. So either you need to learn how to balance these four. And it's very interesting, you know, because if you have all these four on the maximum, you're not gonna do it. So if you look at your life, let's say when you are in your 20s, your education or your professional life is going to be turned on to the maximum, but your family is going to be at the minimum because you're not married, you don't have kids, you don't have a family yet. Once you are at 35, you got married, now you have kids, you cannot have your profession at full blast, your life, your family life at full blast, and the other two at full blast. So what's going to happen? Probably your career is going to still be at full blast. Family is now at full blast. What is going to suffer? Probably your sports and your social life. You have to turn this down in order to, you know, to spend more time in the other two. So your social life probably is going to be sacrificed. You're not going to go to the gym as much. And, you know, we see that. Once you are 50, your kids are now grown up. They don't need you as much. Here, you can turn a little bit down your family. And what turns back up is your sports and your social life. That's why you see people when they are in their 50s, they start going back to the gym again. They start going out with their friends again, you know, because their kids, they do not need them anymore. Once you're 65, you're spending much more time on your leisure activities because your career went down. Now you're retired, so the career thing went down. You spend much more time with your family. You're going out more with your friends and so on. So these four burner theory, it's very interesting how depending where you are in your lifespan, you have to choose which one to turn on and which one to turn off, because there is no way that you can control all four. And please do not feel guilty if you cannot control all four, because no one can control all four. Not, you know, if you want to be successful, there is no way that you can control all four to the maximum. So if you're focusing on your career and you're focusing on your family, that's fine. Don't feel guilty that you're not socializing, because in 15 years, in 10 years, you will socialize because your family does not need you as much. So this is a very interesting balance to keep in mind. So I love that theory.
I love that too.
So I always tell that to my patients when they feel guilty. I'm like, you know, no one asked you to be Superman in all four.
Yeah.
So
I think guilt is like a big thing too.
it is. And, you know, and we bring it to ourselves.
Yeah.
If you have depression, guilt feelings is one of the symptoms. You start feeling guilty all the time. But you have some people where they feel guilty about everything. And even though they're doing an amazing job, but they still feel guilty because these are people that are perfectionistic. And they feel, because I'm perfectionistic, that means I have to be perfect in everything. So including I have to spend 3 hours of quality time with my daughter every night. Well, if you spend 2 hours of quality time, it's more than enough. You know, studies have shown if you spend half an hour of quality time with your kids, but really quality time of your kids, that is enough. So if you're spending 2 hours, you're already doing 4 times more than what's required. Don't put 3 hours as your bar, you know. Sometimes we put the bar too high, we cannot reach it, then we feel guilty. No one asked you to put the bar too high. Just be realistic.
That already makes me feel lighter. Like just hearing you say it like that.
No.
I've been seeing a lot of Lebanese people open businesses, young adults. They're trying to start and establish their life. And then there's all this uncertainty. How do you keep moving forward? How do you keep pushing your life and chasing your goals.
What is the alternative? Not do anything, get disappointed, give up, be pessimistic? That's not good either.
Yeah.
So when we say that Lebanese are resilient, we hear that a lot. And I have my own say about that. I don't think we are as resilient as we think we are. I will come back to this. But we're definitely strong. We're strong, we're not resilient. We learned that you have to keep on going because the alternative is just to crash and to be home and to be depressed. So my advice to everyone who's starting a new business, keep on going, keep on working, keep on planning. Maybe if you wanted to open your business next week, it might not be the best time to open your business next week, but it doesn't mean that you just sit home and be depressed. Well, during this time, you might be working on your marketing plan. During this time, you might start your Instagram page. During this time, you might be recording podcasts. During this time, you might be planning things on how to improve your business. So the minute you can press on go, everything is already done and everything is already planned. So the way, and that's what I'm doing with my NGO, that's what I'm doing with my clinic at the present time. I had a lot of plans that I had to pause, but at the same time, I'm taking the advantage of this time where I hired a marketing person, where I'm doing planning things in order to, in 2 months' time, I hope, when things go back to normal, these 2 months, we were planning what to do in 2 months. And that's what I advise everyone. Do not despair. Do not just sit at home. Take this time consider it as free time for you to think on your future, on how you're going to improve your future. To come back, even though it was not your question, but I'm discussing that resilience of Lebanese people. We keep on hearing that word that, Lebanese people are resilient and so on, because we see that restaurants are full and we see that even though the war is ongoing, we're still going out. Well, that's not resilience. In fact, the NGO that I direct, IDRAG, we are the ones that do a lot of studies on mental health in Lebanon. So a lot of the numbers that you see in Lebanon, the national studies, the big numbers, probably came from IDRAG. We did a national study prior to 2019 where we showed that 25% of the Lebanese population had a psychiatric disorder. So 1 in 4. Now, this number is not extremely high. This number is the world's average. If you look at the WHO, they tell you that around the world, 1 in 4 around the world, 1 in 4 people have a mental health problem. So we were similar to other countries. We repeated the study in 2023. So that was prior than the previous war. So it's funny. We finished our data collection in September 2023. The war happened October 2023. The numbers in Lebanon, because of the last 6 years, what we went through, the number jumped from 25% to 63%. It was a huge jump. So we were from 1 in 4 of the Lebanese having a mental health problem to 2/3 of the Lebanese having mental problem, and that's not including the war. So to say that we are resilient, that is not true. Now, are we stronger than other populations? Yes, we are. Because if what happened to Lebanon would have happened in the US or in France or in Germany, those populations would have been really destroyed. They would have been in much worse shape. But we are paying the price. We are really tired. We are really depressed. We are really anxious. And now the war on top of it is adding a toll on us. Having said that, I'm not saying that we should despair, but we should not hide behind our finger anymore that no, we're good, we're strong, nothing is affecting us. No, we are tired. So if anyone's listening to this podcast or watching us, if you feel that you're anxious, if you feel that you are depressed, there is help. Please do seek help, because 2/3 of the Lebanese are just like you. So don't be ashamed of it. Psychiatry or psychology is still a taboo in Lebanon, but a lot of us are tired. And when you seek help, you will feel better. So please do seek help, because the alternative is what? As I said, just to sit home and crash and be depressed and not do anything, that's not the right way. So I don't want to sound negative, but we are tired, but there is something you can do about it. That's the good news.
And why do you think therapy in Lebanon is still a taboo? Do you think that's changing?
It is changing. It is definitely changing. I'm very successful. I'm living well, it's because people come to me, and a lot of psychiatrists are working very well, a lot of psychologists are working well, because there's more and more awareness. And the more the younger generation, the Gen Z and so on, there is awareness that mental well-being is extremely important, and a lot of the younger generation, they know that, mental well-being is as important as your physical well-being. And the younger generation are now bringing their parents to us. It's like, stop saying that you were in the war, stop saying that you lived the civil war, stop saying that you were strong, stop saying that you went through worse time than now, because that's what your parents always say. It's like, oh yeah, you should have seen us in the civil war, how we used to do. Okay, good for you. But now you're not well. Now you need to get help. For the older generation, the fact that you went through the civil war, now that there is a new war, the trauma on those older people is worse, because these people lived the civil war through 15 years. They did not deal with it. All they did is they let time heal their wounds. And time will make you forget, but time will not solve your problems. So what time did is only hide the problem somewhere in your brain. When a new war starts, all the files get reopened in your brain, and all the old memories start getting mixed with the new memories, and everything is mixed together, and those people get a worse trauma. And I know it from myself, because I lived through the Civil War. Whenever I hear a plane passing by, whenever I hear a bomb, automatically some memories from the 1980s come to my mind before the recent memories, because I realized that I never healed. I never dealt with my traumas. We had to run to the shelter and all of that. All those memories, now I'm realizing, are so vivid in my brain. They're still so present. So because I'm a psychiatrist, I know how to deal with those. But a lot of people are not psychiatrists. They're not equipped on how to deal with that. So if you're suffering, if you're having PTSD, if you cannot sleep, if at any noise, if you hear the thunder, you're jumping, you're on edge, that means that you have all traumas that have not been healed. Talk to a psychologist. It's not a taboo. Just talk to anyone. And people sometimes think that mental health, automatically you have to take a medication. That's not the case. That's not true. There are so many things you can do without taking a medication. And if you have to take a medication, medications are not addictive. Medications, because that's what people think, that psychiatric medications are addictive. I'm going to take a medication and I will be stuck on it the rest of my life. No. You will take a medication for 6 months and you will stop it. If you have diabetes, if you have hypertension, you will take the medication for the rest of your life. But for depression and anxiety, you only take them for 6 months. So even though I'm saying you don't have to take medications, but let's say your depression or anxiety is severe, the medications will only be taken for 6 months. And the side effects of medications, especially the newer ones, are much less than Panadol. So you don't really have to be scared of medications. The worst is not to get treated. The worst would be to be scared of the treatment. So I decide I'm scared of the treatment. I don't want to get treated. So I end up paying the price for years and years and years to come. Who's gonna win? No one. Who's gonna lose? You. So please
I hear
do
a
seek
lot
help.
of the people say تعودنا, like we got used to it.
ما بعرف شو يعني تعودنا honestly. إنه تعودنا to what? تعودنا إنه to be always pessimistic. تعودنا to anytime you hear thunder, you jump, you think there's a bomb. تعودنا not to be able to plan what tomorrow is going to happen. That's not تعودنا. That's, there is some form of resilience, but there is also giving up. And I don't want people to give up. Why should you give up? I know we're living in a very bad situation. And what happened to Lebanon in the last 6-7 years, since 2019 till now, one storm after the other, one trauma after the other, it's like khalas, but it is what it is. Either we're going to say, I have a problem and I need to treat it, or I'm going to say, تعودنا, I'm going to live in pain. If you have a disc, if you have a back pain, would you say تعودت to the pain and I'm not going to do anything about it? Or no, I say I'm going to go to the physiotherapist to make my back muscles stronger, so I will not be suffering from that pain anymore. It's with your brain. It's exactly with your mental health. You cannot say تعودت. Do something about it. You will feel better.
You also said something that really stood out to me, the time heals all wounds. I hear that a lot. Do you think that we're all like, okay, time has passed, I feel better now, and that there are things actually that are unsolved, not healed within us?
Look, time solves problems for the majority of us. I'm not going to deny that, but there is a subset of people where time does not heal anything. And let's say you and me, we lived through the same trauma. God forbid, now a bomb, falls next to here, and we lived the same trauma. We're both going to have what we call acute stress disorder, where for the next week we're going to have nightmares, we're going to feel on edge, where we're going to relive the situation that the bomb is happening, where anytime we hear thunder or we hear any loud noise, we're going to be very worried and very scared. That is very normal. 90% of people will have those symptoms for a week or two. Now, in 4 weeks' time, you have around 10% of people that will continue on having symptoms. And around 90% time healed, so 4 weeks later, 90% of people probably time healed those symptoms and they will not have those symptoms. So you might be among the 90% where in 1 month or 2 months you will forget the event, you will sleep well, you don't worry about it anymore. Me, among the 10%, I'm going to develop what we call PTSD, post-traumatic stress disorder. And once I develop PTSD, those symptoms will stay with me for years if I do not get treated. So time can heal for some people, but if after a certain period of time you're still having the symptoms, time will not heal anymore. And on the contrary, time will be against you, because the more you wait, the worse your symptoms are going to be and the harder it will be to get treated. So after a certain time, please, if you're still having symptoms, do get help, do seek treatment, because it is like someone who is having a heart attack and they're just waiting. The more you wait to intervene, the worse your heart is going to be, the more the chances you're going to die. Well, here we're dealing with the brain, which is, in my mind, it's more important than your heart. It's more important than your kidneys. It's more important than any other organ in your system. So if you treat your heart right away, if you're treating your kidneys right away, how about your brain? That is even more important than those. So go and treat it.
A lot of the times I've noticed people just, they vocalize how they feel maybe to their friends or something, and okay, they let it out. But how do they, find the moment that they're like, okay, no, I don't want to tell my friends anymore. I want to actually go and speak to a therapist.
That's a very good question. And my easy answer is, once you feel that your symptoms are interfering with your day-to-day life, that means there is something wrong. So because of your depression or because of your anxiety, because of your trauma, you're not enjoying life anymore, you're not going to university anymore, you're skipping classes, you're not able to go to family gatherings anymore, you're not focusing at work, and you're getting remarks at work that you're not doing well, you're not able to spend quality time with your husband or with your kids. So anytime that you feel that your routine is being affected and it's affecting your day-to-day functioning, that means the symptoms became to a certain extent where you need to seek help. You see, that's the easy way to know when something is becoming a disorder and not just regular symptoms that will pass. So once you have interference with your day-to-day, do seek help. Now you asked about the emotion that, once they talk and they take it out of their chest. And this is really very important. So this is one of the things that we do. What we advise people is emotional expression. So when someone comes to me, if I see that their symptoms are not severe, I really advise them, don't take medication, engage in emotional expression. Some people, they like journaling. So the fact of writing down their emotions at the end of the day, they're putting it on a piece of paper or on their app, that is, very beneficial for some people.
I love journaling.
Yeah.
I've been journaling since I was 8 years old.
You
I have
see?
like 5 books.
So-
More.
So
Yeah,
it is,
it helps.
it is very effective for some
Yeah.
people. Some people, they express their emotions by dancing or by painting. You have beautiful paintings here. By singing, by playing the piano. So any way, by dancing, whatever it is, express your emotions. Some people, they like expressing their emotions by talking to friends. That was your question. Do so. Some people express their emotions by talking to a psychologist. So when you are talking to a psychologist, half of it is expressing your emotions. The other half is, is to learn how to think about the situation, how to change your thoughts and so on. But the first half is emotion expression, which is extremely important. And I advise everyone to find an outlet on how to express your emotion and do so. For me, it's in sports. That's why I do it regularly. And I feel wonderful after exercising, especially when I run. So when I go to the gym, I don't feel it as much, but I run 3 times a week. So when I run, I feel a rush of adrenaline in me, and I feel so much better. And on Sundays, for example, I always engage in long runs where we run for 2 hours. We are a group of people
Wow.
where we run. Yeah, I'm a marathon runner. So we run, we are the same group. I look forward to that group, to that run in the morning on Sundays, because I'm exercising, I'm running, but at the same time, I'm socializing and we're sharing stories, we're sharing anecdotes, we're sharing whatever. So it's a wonderful time. I'm expressing my emotion being through sports and in a social gathering at the same time. So I advise everyone to find what you like and engage in it. You know, some people might be art class, go for it. Some people might be, learning a new language. Whatever it is, just do it and focus on it, and you will feel better.
And this might be a simple question, but how does someone know if they should go to a therapist, psychologist, or psychiatrist?
So it depends on your symptoms. So if you have, let's say, mild or moderate symptoms, a psychologist will be more than enough. If you feel that your symptoms are really severe and you're really feeling paralyzed from your symptoms, then you have to see a psychiatrist because you need a medication. And here I always compare it to back pain. I just gave the example. Let's say you have back pain. Some back pains are solved by a physiotherapist. Some back pains you need surgery. So this is the equivalence. When you need surgery, that's when you need to see a psychiatrist. When you need physiotherapy, this is the psychologist. So if you put it this way, people understand it easier. And a lot of times, the physiotherapist and the surgeon, they work together. So you do surgery, but then you need 10 sessions of physiotherapy. So that's why in my department, in my group, psychiatrists and psychologists, they work hand in hand. They work together. So one is not against the other. So if I'm giving a medication, I still need rehab to the brain. So that's why most of my patients that are on medication are undergoing therapy at the same time. And when you're doing both, then you have the best outcome because you're teaching the person on how to change their behavior, how to change their way of thinking. So you don't rely on the medication anymore. You can stop the medication faster. And when you're teaching someone the tools on how to take care of themselves, God forbid in 6 years they have a same trauma, they know how to deal with it, they don't relapse, and they need to run to medications. Okay. So that's why we work hand in hand.
And why do you think some people feel like asking for help is weakness or they feel weak?
This is the misnomer, or this is not misnomer, but this is the misconception that people feel that if you're asking for help, this is that reflects on your character, weakness of character. It has nothing to do. It has nothing to do with weakness of character. By any means, it has nothing to do with weakness. I don't know, but yeah, I hear that quite a bit. If you fall and you break your leg, you don't go to the doctor and get treated because that reflects that you have weak bones.
I love that you always give a way to think about it. That's like very...
It's like I'd go and I get treated. I'm not going to think that, the doctor's going to think I have weak bones. No one's going to think you have weak bones. You have a fracture, I need to treat it. If you're developing depression, if you're developing anxiety, it has nothing to do with your character. Nothing to do. Because as I'm telling you, in Lebanon now, 2/3 of the Lebanese have depression or anxiety. Does it mean that 2/3 of Lebanese are weak in character? No. We know that we have a very strong character. We know that us as Mediterraneans, us as Lebanese, we're very loud. We have a very strong character. We're very opinionated. So that is a perfect example, perfect proof that it has nothing to do with character.
And how can you help a friend that's struggling? What are the best things to do?
Well, point it out to them, because a lot of times they don't know they are struggling, or they just tell you, oh, no, I'm okay. I know how to deal with myself. I know how to deal with it. Okay. You know how to deal with it. If in 1 month they're still going through the same thing, that means it's not that they don't know how to deal with it. That means that they need a professional to help them deal with it. So point it out in a nice way and show them how their life was before and how their life is now. When they tell you, no, I'm okay, and you tell them, what do you mean you're okay? You used to go to the gym 3 times a week. We used to hang out every Saturday night. You used to go to every single play that would open. You were the first one to be there at the opening. Now it's been like a year you did not go to any play. It's been a year you did not exercise. We don't see you anymore. What does it mean? It means that there's something wrong with you. So let me help you, point you out to the resources. You can read online, you can exercise again, you can come with me. Or if all of those fail, it will be important to talk to a psychologist. There is nothing wrong by talking to a professional that will help you. Just like you have a physical therapist, just like you have a life coach, just like you have an accountant to tell you on how to manage your finances, you have someone that will tell you, that will teach you how to manage your emotions. It's exactly the same.
What are some ways to handle anxiety when it like randomly hits at night or early in the morning, someone wakes up feeling anxious?
Exercise is very important routine because exercise is your stress reliever. It's the natural stress relief of the body. It's like as if you have a pressure cooker, a presto, and you have the whistle. The whistle of the presto is to relieve the pressure inside the
Can it be like walking or
any
Okay.
exercise. So any physical movement, when you do it regularly, it is extremely important to not let stress build up in your system. So the more you're doing it, the better you will feel. Now, let's say even if you're exercising, you wake up in the middle of the night and you're feeling anxious and you cannot sleep. What I do is deep breathing. And deep breathing is wonderful, it's cheap, it doesn't cost anything, and it's so easy to do. Deep breathing is just a fact of, if you are in bed, you're just, let's say, lying down comfortably, where you take a deep breath from your nose for 4 seconds and you do it in an expressive way. So, to hear the sound of the air coming in. Try to hold it 4 seconds inside your chest and then exhale from your mouth for 4 seconds, but also forcefully to hear the sound. So, okay. By doing this repeatedly, let's say 4 or 5 times in a row, but slowly, 4 seconds in, you keep it 4 seconds in your chest and then 4 seconds out. And while doing it, you're listening to the sound. So you're focusing on your breathing. When you do that 5 times in a row, automatically your system is going to decompress, your system is going to slow down, and you will feel much better, you will feel relaxed, and you will be able to fall asleep. And this is a technique that I started using. I learned it when I was doing in medical school. So when you are in medical school, you have to work very long hours, you have to take calls, you have to be sleeping, let's say in the hospital, and then they wake you up at 3 a.m. to go see a patient, you come back at 4, you are, on your on edge, you need to sleep because you don't know what time they're going to call you again. And that's when I learned to do that deep breathing, to relax my body, to relax my system, to be able to sleep. But this deep breathing can be done at any time. So you can be in the car driving and you feel a panic attack is coming to you, exercise it. You might be going to a meeting and you feel anxious, do it. You might, at any time you're going to just go to the bathroom and do it. So 4 seconds in, 4 seconds inside your chest, 4 seconds out, your system will relax and you will feel much better. So that's a very easy, cheap, $0 technique that anyone can do.
Are distractions helpful or harmful?
Distractions are very helpful because that's when you're distracting yourself, that's when you're expressing your emotions into a hobby, let's say. So when you have a hobby, it is extremely helpful. And that's why I was saying earlier, painting, dancing, playing music, whatever it is, the more you spend time on your hobby, the better it will be. Because at any time when you are feeling stressed and you engage in your hobby, automatically you're going to decompress and you're going to feel better. And one of the things that I do, for example, because I do work long hours, so in addition to exercising every morning, usually around midweek on Wednesday, Thursdays, I'm starting to get tired from work. So I start planning what I'm going to do on Saturday. Am I going to invite friends over and try a new recipe because I love cooking? Or
Okay.
am I going to go out to a restaurant? And I'm known to be among my friends that I'm the one who always creates the programs. And I do it on purpose. So Wednesday afternoon, let's say I'm at work, I have a WhatsApp group. I create, I'm like, what? I feel like cooking on Saturday. So I send, my friends a message like, book yourself Saturday night. I'm trying a new recipe. You're all welcome because, I'm going to be cooking. By doing so, I engage myself that I'm going to be cooking. So starting Thursday, every time that I'm stressed, my mind goes to say, what am I going to cook? Oh, yes, I'm going to do this recipe. I start planning the recipe in my mind, how I'm going to go shopping after work to buy the items, how I'm going to marinate the meat on Friday night to be able to cook it on Saturday. So I distract myself for 5 minutes per day, but that is enough for me to keep on going. So those mini distractions, and I use them very frequently in my day-to-day, these mini distractions, I do them to feel better. Also, I do it with my patients. So when I have someone that comes to me and they tell me I am from Tripoli, I tell them, oh yeah, Tripoli, it's wonderful. Give me one restaurant that has very good food, because the next time I'm going to go to Tripoli, I want to try this restaurant. And on my phone, I have folders now for every
Wow.
region in Lebanon, the good restaurants to try. And I'm doing this to distract myself, but also to break the ice and to distract the patient, especially when it's a tense situation, you know. They feel connected with you. You're touching something personal, you know. You're getting interested in their region. They're getting interested in something that they like. And this is called distraction. So we do use those in therapy even to lower the tone or to decompress the situation. And they are very helpful. So yes, I do advise people to distract themselves.
Oh my gosh, I feel like your friends probably wait for your WhatsApp message like, what's the plan this week? What are
Yeah.
we doing?
Yeah.
What is your take on people self-diagnosing these days? Like using words OCD, ADHD, overthinking, anxiety, depression.
You know, I have a problem with that, and especially now with AI and ChatGPT and so on. It's so easy to self-diagnose yourself. And I have no problem at all people reading, educating themselves, and Googling their symptoms or asking ChatGPT about it and coming up with a diagnosis. I have no problem with that as long as do something about it. Seek help.
Yeah.
Don't just self-diagnose yourself. It's like, oh yeah, okay, I have anxiety. Now I know what to do. If you self-diagnose yourself, still go to a therapist, go to a professional, and double check if what you're feeling is what you have. Because number one, AI, the studies are showing as of 2026 is that AI, especially ChatGPT, is right 75% of the time. So that means 25% of the time it's not correct. So 1 in 4 times it might not be correct. Secondly, AI and ChatGPT is as good as what kind of input you're putting. So what kind of symptoms, you know, you're typing, it's going to give you a diagnosis. AI is not good enough yet to replace a doctor to know what kind of symptoms or what kind of questions to ask you to reach the right diagnosis. So, but still, I know that everyone's going to use AI. I'll be a fool to say that no one will be using AI. I know everyone will be Googling their symptoms or typing them on AI. If you already have an indication of what you have, do something about it. Read about it. And when you're reading about it, always trust sources that you know well, documented sources. So you can go to big hospitals, you can go to university websites, and so on. Don't just listen to any influencer online telling you how to deal with your anxiety. So listen to big sources, and if with that you're still not able to find a solution to yourself, that's when you need to seek help. You know, we are here for a reason. I'm not saying to rush to us and to run to mental health professionals. No, there are a lot of things you can do online. There are apps, there are so many things. But if everything fails, come to us. You know, we're here to help. Or if you don't want to lose time, come directly to us. We can point you out to the right resources. So I don't have a problem with people self-diagnosing themselves. I have a problem with people that don't do anything about it. That is my problem.
And what do you mean exactly by don't do anything? Like they just, do they not know that they have?
It's like, you know, I have OCD. Yeah, that's who I am. I have OCD.
That's what I'm saying. Like
You
exactly.
know?
How do you just not like give yourself this title and then it's an excuse for everything in
Yeah, it
everyday
becomes an
life?
excuse. And this is wrong. You know, this is wrong. I cannot just use it as an excuse because I'm not doing myself a favor. I'm not doing others a favor. If you have OCD and you're living with a partner and you're going to forbid your partner from putting something on the left of the table because you have OCD and it has to be on the right of the table, you know, your partner might accept that the first time, the second time, but after a year, you are poisoning your partner's life, you know? So having an illness, having an issue does not only affect you, it will affect people around you. So that's why you have to do something about it because it becomes contagious and people will start, if you're not going to use it as an excuse, oh yeah, you know, I have bipolar, that's why I'm irritable. Okay, your friends will not be friends with you anymore. They will not go out with you anymore because they're not going to understand, oh yeah, you know, poor Linda, she has bipolar, that's why she's irritable. You know, no, I don't have to tolerate you. So you become socially isolated, you become withdrawn. Social isolation will make your depression worse, and it is a vicious cycle. So break that cycle, do something about it.
I wanted to ask, is anxiety something that's hereditary or like how does someone get
It
anxiety?
is.
Okay.
Anxiety is hereditary. Yes, it is. It has a big component. So if your mom has anxiety, there are higher chances that you will develop anxiety yourself. just like high blood pressure, just like diabetes, just like cardiovascular disease. So a lot of the illnesses are hereditary. So it has a hereditary component for sure. Secondly, if you are living in an environment that is anxious, so if you're raised by a mother that is anxious, first, she could have given you the genes, but secondly, you get brought up to be more cautious about everything, so you will develop anxiety. You have higher chances of developing anxiety. So that's why it can affect you double. It can affect you through your genes, but it can affect you the way you were raised. So if your mother has anxiety, but you were not raised by your mother, you were raised by your adopted, let's say, you still have a little bit of chance of being anxious because of your genes. But if you were raised by parents that are not anxious, you might be okay. If you have anxiety because of your genes and you're raised in an anxious environment, higher chance of you having anxiety.
And what is the difference between anxiety and a panic attack? Because I feel some people don't know that they're even experiencing a panic attack.
So people that experience panic attacks, 80% of them do have anxiety. So it is part of anxiety. It is very rare for people to have panic attacks, especially when it becomes repetitive, without having anxiety. We can have panic attack once or twice in our life and it passes. That's fine. But if panic attacks becomes repetitive, we call that panic disorder. And panic disorder most of the time is linked with anxiety. So that's why you need to seek help, because panic disorder is really bothersome. Once you start having it repeatedly, it really affects your life, where you don't want to leave the house anymore. You don't want to go on long trips. You don't take the plane anymore. You're always on edge. You're always waiting when the next panic attack is going to happen. So it will really ruin your social life. It really ruins your quality of life. And panic disorder, even though it's very scary to the person, it is so easy to treat. And that's why it really drives me crazy when I see people suffering from anxiety or panic attacks and they've had it for 3 years, 4 years, 5 years. They're not leaving their comfort zone because they have panic disorder, when in fact the treatment is so easy. And it's so rewarding for me when I treat someone and suddenly they tell me, after let's say 6 months, they're like, doctor, it's been 10 years I did not take a plane. Now I'm traveling. Now I'm planning a trip with my kids. Now I'm going to China to make my business bigger. Now I'm whatever it is. It is so rewarding for me. So it is so easy to treat, yet people resist it. So it's a shame.
And what about overthinking? Is that like a common thing, or is that actually like a...
So overthinking is, all of us do overthink when we are stressed, when we are anxious. Let's say you have an exam tomorrow. Obviously, you're going to overthink about it. You're taking a trip. You're going to overthink. Even positive events will lead you to overthink. So it's not only negative events. Let's say you're planning a wedding. You're planning your wedding, which is a happy moment. Are you going to overthink? I bet you're going to overthink about it. You see? So overthinking is whenever something is happening, stress, stress, it could be positive stress, like, getting married. So whenever there is a stress that's coming up, or you're going through a stress, you are going to overthink. And that's fine. But when the overthinking is going to paralyze your day and you're going to spend several hours per day overthinking, that becomes anxiety. It's not overthinking anymore.
Okay.
Do get treated for it. Seek help.
And like these thoughts that become on a loop in a cycle, how does that cycle just get cut off? Like what does the treatment look like?
So this is when we do therapy. This is when we teach you to just stop, and how to tell your brain for your brain to detect that now I'm entering this loop. Now I'm entering this negative cycle. I need to stop it. It could be through deep breathing. It could be through just changing the environment where you are. It could be through exercise, or it could be through medication, where you just stop that loop and where you're teaching your brain not to enter into that cycle. And therapy is extremely helpful, and especially a kind of therapy called CBT, cognitive behavioral therapy, where we are teaching you to learn from the situation that you are in now, a different way of looking at things, to break that cycle, because sometimes you cannot change the environment that you are in. Let's say, God forbid, you are in a trauma where you lose a parent, God forbid. No matter how much therapy I'm going to give you, you're not going to get back your loved ones. So even though I cannot change the environment, or I cannot change the trauma that happened to you, but I can help you look at that trauma in a different way. So instead of every time thinking of my loved one and getting depressed, I will teach your brain on how to look at the positive things and to remember the nice moments of your dad, the nice moments of your mom, the positive things that were happening. And I will teach you on how to move on to focus on the other positive things that are happening in your life. Even though there was a big trauma, but there are a lot of positive things that are happening now at the same time, and to how to shift your brain from the negative things to the positive things. And all of that is done in therapy. It sounds simple, and it is simple. So that's why people should not be scared of therapy. It does help.
Yeah, I love that you remove the pressure from it.
Yeah.
Because I think it's just the first step that's a little scary. Or maybe it's finding a therapist or a psychologist that you feel comfortable speaking to and opening up to.
And we always hear, I don't want to see a therapist because I don't like to talk about my emotions, or I don't know what I'm going to say. Don't worry. We know what to do. Come to us, we know what to do. It's like you say, I don't want to go to the gym. I don't want to hire a personal trainer because I don't know how to use the machine. But that's why the personal trainer is there, to teach you how to use the machine. That's why we are here, to help you find different ways on how to use your brain. So
when life starts to feel a little bit stagnant, slow, how do you not find yourself creeping into depression?
recognize it. It is important to recognize when you are becoming stagnant. It is really important to recognize that and to do something about it. And the best way would be to fill your time. The worst thing is to have a lot of free time on your hand, because the more free time you have, the more you're going to be sitting and ruminating about your problems. And the more you ruminate, the more you're going to be anxious. The more you're going to be anxious, the more you're going to be depressed, and you enter the vicious cycle. So when you fill your time, when you distract yourself, as we said earlier, that is the best thing that you can do. Also, social connections. Social connections have been proven to be extremely powerful. And it has been proven to be as effective as medications.
So
And
friends.
friends,
Okay.
going out, remain socially active, remain in contact. In Lebanon, we are fortunate where we have a lot of family, we have friends around us, and people do not know the meaning of that or the importance of that until they migrate or until they live abroad. So if you go and live in Dubai, or if you live in France, or if you live in the US, even though in Dubai there's a lot of Lebanese, if you get stuck in that cycle of just working and not socializing, you will really feel how much you miss back home. What
That's
do you miss
true.
back home? What in fact do you miss back home? It's not the traffic, it's not the garbage on the streets, it's not the uncertainty of the war. What you miss back home is your friends, is the social connection, right?
Yeah.
So social connections are extremely powerful. They are so powerful that in fact, as of 2025, in England, doctors started prescribing social connection as a mean of getting treated. And how do they do that? They do that, they will tell you that I need you to be socially connected. So I ask you, let's say, what do you like to do? You tell me, I like to take art classes. The city now in London did a deal with several art classes where the city pays for your art classes. So you come to me and
Wow.
I tell you you have to be socially connected, and you tell me I like art. I will refer you to one of the 8 galleries or one of the 8 social, art classes, where you go and you get 10 free classes because the city is paying on your behalf. By doing so, you are focusing on your hobby, but you're doing it in a group setting. So by doing that, you will get better. You don't need to get medications. You're not depressed anymore. So in England, you have the NHS, where the government is paying for you. So for them paying for your therapy and paying for your medication, they found out that paying for your art class is cheaper than paying for your medication and your therapy, and the outcome is better. So that's why we call that now social prescriptions. The US is learning from that, and a lot of private companies, because in the US it's all governed by private insurances, they started looking at that, and they saw that if I pay for your gym membership, if I pay for your swimming class, if I pay for whatever it is cheaper than paying for a therapist, and it's a win-win situation. So social connection is extremely helpful.
Wow. Even I did like a friends painting night. I got a table, mini canvases, everything to paint, and it was really nice. It was
Yeah.
just like everyone painted what they wanted to paint. We put music, like those are activities that I think just really change your day, your
So
week, and everything.
I completely agree. So please find your hobby,
Yeah.
find what you like to do. And if you can do it in a group setting, it is much, 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 much better. You
Wow.
like reading, get engaged in a
Get in a book club.
book club.
Yeah.
You like painting, do it as you said with your friends.
Hmm.
You like running like I do. Every Sunday we run as a group, and I have a team, and it's wonderful.
Okay. That's a great advice.
Yeah.
I think we have to start like putting that effort and extra step to like making plans with our friends, checking in on our friends, doing little activities that now it's just like, wait, you want to go and paint? Like maybe instead of going to a dinner, like actually planning things that are different than the usual type of activity. So that's
Small
nice.
things,
Yeah.
small things.
I know we talked about a lot of things that you should do when you're feeling anxious, but what are things that you should not do?
Don't drink and don't use drugs.
Mm.
I see that frequently when people drink alcohol, or now, because more and more people think that weed is not harmful, especially the younger generation, they start, they smoke a joint at night to relax, and it is terrible. It is terrible for your brain. And here, especially the young generation, they think that because weed is becoming legal in Europe, it's becoming legal in the US, that means it is not harmful. And this is very wrong. Being legal has nothing to do with being harmful. Because a gun is legal, it does not mean it does not kill you. You see? The reason why they legalized weed is because they did not want to invest anymore on the police just chasing everyone that is smoking a joint. They did not legalize it because it is safe. They had their own political reasons and financial reasons why they
Yeah.
legalized it. We know that when you're using weed as a treatment for your anxiety, it is really bad news. Now, someone wants to smoke a joint on a Saturday night, once a month, okay, that's fine. Just like someone, having a drink once a week, it's fine. But when you start doing it every day to feel relaxed, that's when you're becoming addicted to it. That's when you are killing your brain cells. That's when you're putting yourself in a state of mind where you're always pressing your emotions, and you will have a worse outcome. So please don't engage in self-treatment and substances like that. That would be a big
Mm.
no-no for me.
Why is it that sometimes anxious people assume the worst to like protect themselves and not get disappointed?
It's part of anxiety. That's why I want people to get help, because part of anxiety is always expecting the worst case scenario, and you live your life based on the worst case scenario.
Yeah.
And I have a family member who is like this, who, other than poisoning her life, she poisons the life of everyone around her because he's always living based on the worst case scenario. Like, there's always one chance in a million that something will happen. She lives based on that one chance in a million, and she starts bringing people down around her if they don't see this one chance in a million. And even though we tell her, but this is one chance in a million, look at the other side. It's like, but who told you that's not going to happen? So by doing this, they are really always living with always living as if you have a hot plate and you're always sitting on a hot plate. You're always burning yourself. And haram, haram, haram. It's
Yeah.
terrible. So please do something about it and get out of it, because as I said, and I said it multiple times during this podcast, when you have anxiety, when you have depression, it's reflected on others. You start affecting people around you. So if you don't want to seek help for yourself, think about your environment. So haram to burn yourself just to always be living on the edge.
How can people keep up with the news and with social media without getting so overwhelmed by it?
Don't overexpose yourself to it. And I know it's easier said than done, but the continuous bombardment of negative news, that's what causes anxiety. So when you have the news apps and constant notifications on and
Mm.
constantly receiving notifications, that's when you are poisoning your life for no reason. The way I do it, I have all the notifications off on my phone. All of them are off. When I wake up in the morning, I do open a news app, to see, just to screen very quickly in 2 3 minutes to see what happened overnight.
Yeah.
Then, when I take my lunch break, I open the news app and I see to see if anything happened. And then at night, I watch the news for like around 15 minutes. That is the extent of my exposure to the news. So I do it 2 minutes in the morning, 2 minutes in the at noon, and around 10 15 minutes at night. I don't do more than that because I know if I'm going to be constantly checking the news and I have all the notifications, I'm going to be, as I said, poisoning my life, and I will not be able to focus on the patient that is in front of me or on whatever job you're doing. You cannot be able to focus because if every time you're going to look at your phone that's ringing and to check the news, you're poisoning yourself. And what is the point of checking the news every single second when it is not under your control and when you cannot do anything about it? So some people tell me, yeah, no, but I need to know what if there is an evacuation of my building? Well, my answer is someone else in your building is watching the news. I am sure you will receive a WhatsApp. I'm sure they will call you.
It can be a lot.
It is. It is draining. It is
Even
draining.
social media, like people might use it to just scroll and, even as maybe a way to turn off their mind, but it's not.
It is numbing. It is not. It is
Yeah.
not. I went to the hairdresser a week ago, and I saw a guy. He was sitting at the chair. They were washing his hair before getting the haircut. The guy was holding his phone. I swear, I'm not kidding. He was just like sitting on the chair and just doing the
Mindlessly
movement,
scrolling.
doing the movement of scrolling without even looking at his phone. So the hairdresser told him, "What are you doing?" He's like, "I have an addiction of scrolling."
Oh, what?
And I looked, I'm like, wow, he has an addiction of scrolling. So even though he's not looking at the phone, he's just, doing the movement. So this
How
is
old
someone,
was he?
he was in his 20s. So when he finished, so the guy jokingly, the hairdresser told him, well, you need to talk to Dr. Karam. He would be the best person to help you. He turned to me, he's like, oh yeah, I know you from social media. I'm like, well,
Wow.
okay, you know me from social
So he
media.
scrolled and he found you.
So he scrolled and he found me. That was a good thing. But the negative thing, he told me he spends around 8 hours per day just scrolling social media. 8 hours per day, 1/3 of your time. Imagine. So it is, some people have an addiction on that, and we have to put brakes to it. It's terrible.
Do you think those time limit things, like, do they actually
They do
help?
work, and that's what I have with my kids.
Okay.
So with my kids, for example, at 8 p.m. their phone locks, and if they use their phone more than an hour and a half, it blocks, it stops. So just on purpose, not to be on YouTube or just like this passively.
Yeah.
So yeah, it does work.
I like to talk a lot on my podcast about navigating adulthood, and that's a big theme for me. So what do you think now young adults are struggling with most mentally, and like when it comes from within their inner world and society?
So I think the problem is the way young people were raised is now showing some problems where they were extremely sheltered. So the new way of raising our kids was to shelter our kids from everything, to encourage our kids on everything, that my kid is the best, my kid is doing extremely well. I don't allow them, we do not allow our kids to get hurt in anything. We overprotect our kids, which on one side it is good, but the overprotection of kids, and that has been all over the world, that is the new way of raising kids, where you overprotect your kids. Unfortunately, when these kids now that are young adults, they enter the world, they enter the market, the job market or whatever, they receive a slap on their face where, oh, wait a second, life is not as sheltered as my parents told me, or I'm not really the best or the smartest or the most intelligent or the most handsome or whatever it is, the way my parents raised me. Oh no, there's a lot of competition. Some people are better than me. Some people are smarter than me. And I see that quite a bit where, you have this clash where people were raised in a very sheltered environment. Suddenly now it's like, they receive a slap. And these people, some of them can either get burned out very easily, or they feel depressed, they feel disappointed, or they get anxious. So it's important to mention that my message to parents, don't over shelter your kids. The way we used to raise kids maybe 30, 40 years ago was not that bad, you know. Obviously, don't punish your kids. Obviously, don't hit your kids. Don't use, verbal punishment. Obviously not. But at the same time, not everything is rosy and peachy. You need to have structure to your kids. Your kids need to have a parent, not a friend. Because now the way we see, parents are acting much more as the best friend of their kids rather than being the parent of their kids. Your kid, they need a father figure, they need a mother figure to tell them what's wrong, what's not, and to establish a certain routine and to establish a certain discipline. This is my message to parents. If you are a young adult and you were not raised on a certain routine, you were not raised on a certain structure, it is time to really put a routine to yourself. It is really time to step up and not to think that everything is allowed, not to think that, oh yeah, I can act the way I want and society has to adapt to me. No, society does not have to adapt to you. You know,
So
don't
it's
be
like
that
taking
entitled.
accountability.
Be accountable.
Yeah.
Yeah, you have to be accountable. You have to step up. Now you're an adult.
Mm-hmm.
You cannot just misbehave and expect that people are going to tell you, oh yeah, you're wonderful, just like your parents used to tell you you're wonderful. So be accountable, put a routine to yourself, focus on your career, and you'll be successful in life, you know.
And what are some things that you hear very commonly with Lebanese people? Like when they come to you, is there something that you've noticed more here versus, your patients abroad?
There's more anxiety,
Mm.
there's more PTSD, post-traumatic stress disorder, because we
Mm.
are living through traumas. There's more depression for sure. Uh, but but the problem is the that we don't have enough resources like we have in the US. Let's say in the US you might have a private insurance that will pay for all your therapy sessions. Here, a lot of the insurance companies still do not pay for your insurance. You have to pay out of pocket. In the US, if your bank collapses, the government can help you regain your money. Here, you lost all of your money in 2019. No one is helping you. So we do have a lot of stressors here that we don't have in the US. However, there are some positive things in Lebanon. One of them is the family.
Mm.
One of them is the friends, as we mentioned earlier. So the amount of social connections that we have in Lebanon are wonderful. And me as a psychiatrist, I really rely on the social connections of my patient, and I push them and I ask the parents to come, with their loved ones to the sessions to be able to build on that, because you will teach the parents on how to continue the therapy at home. So you
Mm.
see, so it's really wonderful, and that's why the outcome in Lebanon is better than in the US. I worked in the US, I still have an office there, and I work in Lebanon, and I can tell you my outcome, I'm the same doctor, I'm using the same medications, I'm using the same technique. I have a better outcome in Lebanon versus the US because I can engage the family and the family become a very good ally. So that is really, a wonderful tool that we have here.
Okay, nice.
Yeah.
I want to move to the last part before we wrap up. I thought it would be so nice to have some listeners send in questions based on how they're feeling at the moment, a little bit about uncertainty with the situation in Lebanon. So let's see what they said. Do you have any tips to help with getting out of a depressive episode?
So expressing your emotions, exercise, meditation is a very important one. And there are so many apps, so many YouTube channels, they can teach you meditation, where meditation is, in a nutshell, where you learn how to calm down and to quiet your brain and just to focus on the here and now. It's like to be mindful of where you are, to be mindful of what you're doing. And this exercise, if you do it 10 minutes every day, it has been proven to be very important for your depression. It has been very important for your anxiety. It has been shown to be very important for physical problems. So people that engage in meditation for 10 minutes per day have lesser chance of having high blood pressure, less chance of having cholesterol problem, less chance of having cardiovascular, like heart problems. So I really advise people to engage in physical activity and in meditation. Now, the way I do meditation, I do it while exercising. So that's why I love running, Because when I'm running, I'm in the zone and I'm just focusing on how I'm running and I'm focusing on myself. So it's two in one. You do it and it's free. You can do it anywhere and it is extremely powerful. If that does not work, then recognize that you have a problem. Talk to a friend, talk to a life coach, talk to a therapist. Google your symptoms, see what you can do. If all of that fails, then you can come to a mental health professional.
Any advice on ways to stay motivated and achieve day-to-day goals?
Put a plan of what you need, what you want to achieve. By putting a plan on what you want to achieve, every time you feel demotivated, you look back at the plan, at your original plan, and that will push you forward. So when I put a plan, let's say that within 1 year, I want to be the best artist in Lebanon. The war happens and it's preventing you lose your motivation from painting. After 2-3 days, you have to remind yourself, in fact, what was my goal? Oh yeah, my goal was to be the best artist in Lebanon. If I'm going to sit on the couch and just be depressed and just be demotivated, there's no way I'm going to reach my goal. Well, let me restart working on that goal. It might be 2 hours per day, not 8, but 2 hours are better than nothing. Let me do that. And once you restart doing this, the 2 hours will become 3, the 3 will become 5. Before you know it, you're focusing for 8 hours and 10 hours. So always have a goal in mind and go back to the original goal and remind yourself what is your ultimate goal in life, and you will automatically you will push yourself to do it.
Yeah, I love that. I like the idea of vision boards and
Yeah.
and seeing and putting out what exactly you want, because
Exactly.
just like general ideas, I mean, you can think like, oh yeah, I wanted to do that one thing, but like, how do you stay consistent with it?
Steve Jobs, the founder of Apple, today is the 50th anniversary of Apple, the company. Yeah, interestingly. So I was reading the autobiography of Steve Jobs before he died, and what he used to do every morning, every single morning, while shaving or brushing his teeth, he would look himself at the mirror, and he would tell himself, if tomorrow is, if I know that tomorrow I'm dying, how do I want to spend today? And that's how he used to live every day. So every day he would tell himself, if tomorrow, I'm dying tomorrow, I know that tomorrow is my last day, how do I want to live today? And he would put a plan on things that he needed to achieve that day. And I think that is a great motivation, that every day in the morning, think about what you want to achieve. And I don't think any one of us is going to say that today I just want to be lazy on the couch all day long. You might do it once or twice, because you're tired, you say, today, Sunday, I want to be lazy all day long. But you're not going to do it on Monday, Tuesday, Wednesday, Thursday. If you find yourself telling yourself every day that I want to be lazy in the couch, not move, that means you have depression. Do get help.
Okay.
So I think that's,
I saw a girl say something like that. She's like, imagine you're 80 years old and you get told you get to go back and spend one day in your like 30s or 40s and just be young again. How would you spend that day?
Exactly.
And she was like, I would be at the beach. I would be doing this. I would be doing that. So it is really all a mindset.
It is all a mindset. And also another advice, when you find yourself caught in a loop where you are anxious, I tell the person, imagine your friend is telling you that. What would be your advice to your friend? 99% of the time they would give the right advice.
Yeah.
I'm like, okay. Apply it on yourself.
Apply it on yourself.
Apply it on yourself. Be your own friend.
It's crazy how much nicer we can be to our friends than to yourself, even.
That's very
in
true.
your thoughts. It's like,
that's very true.
It's
Crazy.
It is crazy.
Yeah.
What can someone do if they don't have access to a therapist?
Because of financial problems or?
They didn't say.
They didn't say. Okay, because if it's because of financial problem, you have this, or again, misconception in Lebanon that therapy is very expensive. No, it's not very expensive. It's not more expensive than physical therapy. It's not more expensive than getting a massage. But it can still be expensive for some people. There are a lot of NGOs in Lebanon that are helping, that are offering reduced prices or even free of charge. So this is very powerful. But even if you don't want to go to a therapist, there are some apps now, and the Ministry of Health in Lebanon, in fact, has 2 apps. One of them we co-developed with them as Idrag, free of charge apps where you can just log in, completely anonymous, and you can follow a program online through a podcast, teaching you tips, teaching you techniques, giving you exercises on what to do in order to take care of yourself. So help is really free and it is available, and you can decide to do it at 2 a.m. So please do seek help. And if anyone has a problem on how to find help, they can just contact me, and I'm happy to point them to the right resources because they are available.
I'll put your socials and
Sure,
information in the
sure.
description. Okay. Can people fully recover from trauma?
They can if they are treated. Don't let time be your healer. If you have a trauma, please seek help. And the earlier you seek help, the better the outcome and the sooner you will feel better. Because if you don't seek help, and we touched on that earlier, if you don't seek help and you just let time be your healer, you might feel better now. But the second trauma you're going to get, you're going to be screwed.
So it layers on.
It does. The brain does not forget. The brain does not forget. And we know that kids that are exposed to violence, be it physical abuse at home, be it sexual abuse, obviously, be it emotional abuse such as neglect, these kids, and we did the studies. So if you have kids at the age of 5 that were physically abused or socially abused, any kind of abuse, these kids have 5 times higher chance of developing depression at the age of 40 compared to someone that was not abused at the age of 5. 5 times higher chance because the brain does not forget. So even though you're not thinking about your abuse, you have 5 times higher chance of developing depression. And frequently, when I have someone, in their 40s and I'm taking history, I start taking childhood adversities. I start asking them if they were exposed to violence, any kind of violence or trauma as a child. Frequently, the answer is yes. So if you're exposed to a trauma as a kid, please do seek help. If you're exposed to a trauma as an adult, again, seek help because the brain will not forget.
Wow. I think that's super powerful
Yeah.
because we think that it's in the past and,
It is
so
not.
many other things happen in life. So it just gets pushed all the way to the back, but it's still there.
It is still there until
Yeah.
your next trauma. And we saw that, when a lot of people lived the civil war and they thought that everything was done and over. When the Beirut port explosion happened here in Ashrafiyeh, so a lot of people living in Ashrafiyeh in Beirut, they lived the war. The first instinct, I'm one of them, and the first images that came to mind was the civil war back in the 80s. And I realized that I'm one of them. I realized oh my God, all the old traumas, all the old negative memories were still there. They were just buried somewhere, and everything rushed back to my current memory because I
Yeah,
did
it
not
just
deal
comes
with it.
back,
It comes
flooding back
yeah.
in. What does healing look like after this conflict ends?
You live normally, happily, and you're not worried anymore, and you're successful in life. You're focusing on your career. You're focusing on your kids. You're just living happily. That's what success is. Success for me is to be satisfied and happy in your life. That is success. And everyone deserves to be happy in life. Every single person, no matter what you have in your life, every single person deserves. If you're not able to reach happiness on your own, we are here to help you.
I love that reminder. It's there is help, it's there.
Yes, it is.
Take it.
It is. It is there. No one has to suffer in silence. No one. No one has to live with a back pain. Why? No one has to live in fear all the time. No one has to live in sadness all the time. No one has to live in anxiety all the time. There is help online. There is help physically. There is help everywhere. You don't want to see a therapist in Lebanon? Seek help with a therapist in the US through Zoom. There are apps. There's plenty. In the 21st century, there is really zero excuse not to get help. Bottom line.
Why do I always feel like I'm under pressure even when nothing is wrong?
Because probably this is someone who is anxious by nature, and this is someone who feels that they need to be in control of everything. And if you're trying to be in control of everything, you're going to burn, quickly, and you will not be able to keep up with everything because you set your bar very high. Be realistic. You don't have to set your bar very high. Even when I'm telling people they have to exercise, I'm not telling you that you have to exercise for 2 hours every day. I'm not telling
Mm.
you that you have to be the fastest in running. I'm not telling you that you have to be the strongest at your gym. Don't set the bar that high. Your bar might be to just go to the gym. It might be for 30 minutes today because I don't feel like exercising for a long time, or it might be for an hour and a half because I feel good. Your bar should be go to the gym. It doesn't mean that you have to be the best at the gym.
Yeah.
The same at work, the same, I'm not asking you to be your best every single day. You know, do what you can, but don't burn yourself by just trying to be in control. And when you're not, you feel that as a failure. You're not a failure.
How to deal with anxiety of canceled flights, the unknown, and being in a long distant relationship.
Focus on what you can control.
Mm.
Again, focus on what you can control. If your flight was canceled, what can you control? Is it under your control? No, it's not. It's not my fault that, it got canceled. Got it canceled because of the weather? Okay, it's not the airline's fault either. So it's no one's fault. I will focus on what I can control. I can control the fact that, let's say, in the flight getting canceled, I will focus that, okay, I need to call my agent to find me a flight in 2 days. During this time, maybe I will try to turn it positively. My flight got canceled, that, okay, now it gives me 2 extra days to spend it with my family. Now
Mm-hmm.
it gives me 2 extra days to finish what I wanted to do. Or, instead of me coming back from my flight in 3 weeks and be rushed to finish things that are due at work, maybe I will take that time now, the next 2 days, to finish so I can be less pressured when I come back. Try to turn it positively. Try to find something positive out of it. Because just focusing on the negative event that is not under your control, you're burning yourself and you're putting yourself in a loop for no reason.
Yeah.
So turn it positively.
Okay. Um, do our minds adapt to constant stagnation and lack of drive because of war?
It does. It does adapt. It can be a defense mechanism at times. And because, we call that habituation. You get used to habitude, you get used to something, and that's why you can keep on going. And we see that, now in war, that you might be very stressed the first week, and then after that, like, okay, life has to go on. Probably the first week you were not going out, you were not leaving your kids at home, you always wanted to be at home. But on the second week, third week, you're like, you know what? Life has to continue. You start going out again. You start going to work. You restart going to your gym. We call that habituation because you get used to a certain situation. And that's a defense mechanism. The problem with habituation is that if you get used to on negative things, you get used on being home all the time, you get used on not going to the gym anymore, you get used on being socially withdrawn, that can play a negative role because that will lead you to be depressed and that will lead you to really completely lose motivation, as your question was saying, and it will be harder for you to get out of it. So if you're getting used on doing positive things, that's fine and that's good. If you're getting used on being negative and self-criticism and guilty all the time, after a couple of weeks, usually we say that is negative, you have to get out of it.
Okay. It's related to food. I tend to eat my emotions. What would you recommend?
Yeah, I sometimes do that. And a lot of us, we run to comfort food. And unfortunately,
Mm.
when we eat our emotions, it's usually the unhealthy foods.
Yeah.
I don't see anyone eating their emotions by eating carrots. Usually it's by eating ice cream, it's by eating
Mm.
chips, it's by eating, the bad food for you.
Mm-hmm.
Be conscious and be mindful of it. If you're realizing that you're doing it, there's nothing wrong by eating a piece of cake. You don't have to eat the whole cake, you know. So be mindful. It's like, now I feel stressed. I need to eat a piece of cake. I sometimes do. It's like, I cannot just stop at one piece. I have to eat the whole cake. And I learned that from my wife. So even though I'm a psychiatrist, my wife taught me that, if you're eating a slice of cake or if you're eating the whole cake, it's the same taste. But what you're doing by eating the whole cake, you're going to feel guilty afterwards. You're going to gain calories and you're going to start self-criticizing yourself how you ate the whole cake. Eat a slice of cake, stop, pause. You're like, okay, I had my fix. I had the taste that I wanted. Stop here because if you go beyond that, it's going to lead you into negative territory. And that's what I apply to myself now. And,
Mm-hmm.
you know, I do that. Another advice would be what I do to myself: don't have the whole cake in front of you. You know, cut a small piece and go eat it in another room. Because if you're going to eat that small cake in front of the big one, you're like, you know what? That was not enough. Let me have another one. Oh, yeah, you know what? Now I have to cut it to be at a perfect angle. So you cut it at a perfect angle, you're
Guilty.
eating more. I know a lot of
Yeah.
people do that.
Yeah.
So cut a small piece, leave the kitchen, eat it somewhere else, and tell your brain, I got my fix. Now I move on to something else.
Mm-hmm. Working in healthcare, doing sports, going out, but still feeling drained. What to do more?
Social connection. So you're going out, yes. Now, if you're going out and you're not sleeping enough, so
Oh,
that might
sleep.
be some of the things. You know, a lot of times we tend to sacrifice our sleep. In order to have time to do everything, sleep gets sacrificed. And we know that sleep is extremely important. It's not by chance that God or nature created us that we need 8 hours of sleep. So we've been doing that for a million years, and even though we've been living for 1 million years, we still need 8 hours of sleep. Because when you are sleeping, this is the time when you're putting your body, as if you're putting your car in the garage. So you're putting your body in the garage, your brain in the garage. This is the time when your brain is healing itself. This is the time when your body is actually healing itself. You know, the cells regenerate, and you're putting yourself in the garage. So if you're not posing every day for 8 hours and putting yourself in the garage for the body to heal itself, you're going to burn. So probably this listener is trying to do everything, and he or she are probably only sleeping 5-6 hours per day to be able to do all this. What happens is that they're going to pay the price. They feel burnt out.
Mm-hmm.
My advice: do not sacrifice your sleep. All of us need 7 to 8 hours. Sleep is very important.
Mm-hmm.
It is so important, as I said, that evolution did not get rid of it. Because by evolution, you get rid of things that you don't need, right? When you think about sleep, let's say sleep, what is the purpose of human beings? Is to be working, is to have kids, it's to be active in life, right? So when you are sleeping, you're not producing, you're not doing anything. When you're sleeping, you're not having sex, meaning you're not having kids, so you're not helping your species to continue. So you're useless as a human being when you're sleeping. In addition, when you're sleeping, think about when you were cavemen. When you're sleeping, that's when you are the most at danger, because that's the time when a lion can attack you or a snake can attack you without you knowing.
Yeah.
So you are useless as a human being, and you are the most at risk. And even with that, evolution did not get rid of sleep.
Sleep is going nowhere.
So that should be powerful enough to tell you that even though it is so useless, evolution kept it because you need 7 to 8 hours.
Okay.
You know.
Yeah.
So please do not sacrifice your sleep. That's what this listener can do.
Mm-hmm. Genuinely, does it get better, or do we just get better at coping with or adjust?
No, it does get better. It does get better, definitely. Now, it starts by getting better at coping. It does get better by you adjusting. That's how it starts, you know, because it's a process. So when you are working through a trauma, it's not going to be solved right away. Sometimes it might take you 6 months of therapy to get better. But until you get better, you're learning on how to adapt, especially if it's a situation that you cannot change. So you're adapting, you're learning how to live with it until you can really get cured and you move on.
How can we make it possible to dream of a good future when even the present is unknown?
It's an important question, and always keep in mind the big picture. As I said, put yourself, work on what's your goal in 5 years. Now it is uncertain times. You don't know what's going to happen tomorrow. But my goal is what I want to be in 5 years. So put a plan of where you want to be in 5 years. And there are things that you can work on even if you are in uncertain times. So let's say you need to be doing 10 things in order to reach your goal in 5 years. 2 of them might get affected now because of the war or because of whatever. Okay. But there might be 3 that you can work on, you see, until you reach your goal in 5 years. So you might switch priorities at the present time to reach your goal in 5 years. So priorities might change, but the goal should not change.
Okay.
Yeah.
That's the last one.
Oh,
That was so good.
yeah, thank
Did you enjoy this?
I loved it. And it was so short.
Wow.
Yeah.
That's short?
Yeah, it
How
passed.
long have we was it short? How long did we record?
Oh, wow. Wow.
Oh
It
my gosh,
passed by like
over
a
an
breeze.
hour.
Yeah. Wow.
But this was so nice. I already feel a lot better.
I'm
I
glad.
feel like we talked about things and you gave so many examples that made it easier to digest and understand. And I would love to do this again.
Anytime. I
Wow.
loved it. Anytime.
That's great. And maybe whoever's listening can let us know different topics to talk
Sure.
about. Really, there's so much I feel. So thank you, Dr. George.
Thank you.
This was amazing.
That's great.
Okay. Is there anything else you want to add here before we end the episode?
My message is that mental health is a basic human right.
Yeah.
No one should be suffering. No one should be denied access to treatment. No one should be sad or depressed. There's a lot of help around. Do seek help, and we are here to help you. No one should be suffering. It is a basic human right.
Wow. I can't even think of a better way to start Sabah El Kheir in this season. This is exactly the intention that I wanted to put. I wanted to talk about so many important things that, you know, we feel every day, but you just don't know how to put it into words. So I think you did a great job at that
Thank
for
you.
us.
Thank you.
Yeah. Okay. Well, for everyone listening, please do comment and let us know what you want to hear next time. And hopefully we'll have you back again. And I'll put your socials so they can
Sure.
follow you along. Apparently you post on TikTok,
I do.
right?
Yeah.
Okay. That's great. So make sure to send this to a friend or someone that you feel should hear this. It might help someone. So that is the goal here. And yeah. All right. Thank you
Looking
so
forward.
much.
Take care.
Okay. Bye. That was great.
Great.